Are you suffering from persistent pain or tenderness over your lateral hip? Finding common weight-bearing activities such as standing, walking, and stairs challenging? Feeling like your hip is always tight and wanting to stretch it, which provides short-term relief, but the symptoms always come back? These are commonly symptoms of gluteal tendinopathy, which can affect both sedentary and athletes alike. However, is most common in women over 40 and runners. This can be an extremely frustrating and debilitating condition. Hey everyone, Dr. Zach Greenwade here with Performance Sport and Spine. And in this video about gluteal tendinopathy, we're going to talk about what's causing your pain. We'll talk about some positions you may want to minimize temporarily. We'll talk about stretching and if it's helpful. And then lastly, we'll show you an exercise progression. Gluteal tendinopathy is a condition where there's been excessive compressive or tensile loads of your gluteal tendon of your greater trochanter of your lateral hip, as well as muscle deficits of your hip abductors. It's also important to rule out any spine or hip referral pain with this condition. So we'll discuss now some positions that you want to minimize temporarily as to decrease this compressive forces. So most importantly is adduction, which is bringing your leg across midline, which we demonstrate here. So the first thing is crossing your legs, either sitting in a chair or sitting on the floor. Now your hip may feel tight and this may provide temporary relief, but this position puts excessive compressive on those tissues that we talked about. The second position you want to minimize is standing and hanging on your hip, where you kind of sink into that hip and you kind of get lax and your pelvis tilts down a little bit. Another position to think about is stairs, walking up or down. Now as you step up, you want to make sure your pelvis stays level as we demonstrate here. You can use your hand to hold onto the armrest if needed, and you want to minimize the pelvis tilting to the opposite side, which we show you here. Fourthly is walking. Again, you want to walk with a pelvis in a neutral position, not tilting down. Now this can also be aided by smaller strides or smaller steps and walking softer. Lastly, sleeping. This can be a very debilitating condition, so sleep in different positions can be helpful. You want to minimize sleeping on the affected side. If you do sleep on your side, you want to put a pillow underneath the greater trochanter, which we'll demonstrate here. Laying on your back can be helpful, as well as you sleep on the non-affected side, putting a pillow between your knees to not let the upper leg fall into adduction or dropping it towards midline can be helpful. So even though it may seem counterintuitive initially, stretching is not advised due to the increase in compressive forces and provocative nature. Now stretching is not all the same, so some light stretching may be okay, but the more time you spend in it, the more likely it is to irritate that tendon. And again, tightness is a symptom, not the cause. Adduction, and you're going to kind of isometrically rotate your feet. So it's going to look like your feet are going to want to rotate out, but you're not going to let them. So you're going to gently squeeze your glutes, and again, try to rip the floor apart. You want to hold this for 5 to 10 seconds, work up to 10 reps twice a day. And this section we'll talk about exercise progression, but before we start, one important clarification is that some discomfort or soreness is normal with this condition, but a couple things to be aware of is the pain should never be severe, and all symptoms should dissipate within 24 hours. So another variation of this is in the supine position. So you're going to lay on your back. Now a lot of people benefit with putting a pillow under your knees to have your knees slightly bent and a band around both legs just above the knees. You're going to spread your feet wider than hip width apart again, and you're going to push your knees outward against the band, feeling some gentle tension in your posterior buttocks. You're going to hold this for 5 to 10 seconds, 10 times, up to twice a day. Okay, now we're going to go over the bridge progression. So the first one is going to be on your back with your heels close to your buttocks. You're going to drive up with your hips and your glutes. Again, you should feel some gentle dull tension in your posterior buttocks and down. Now, one important thing to note with this bridges is that slow tempo is important. So going up slow, like 1, 2, 3, and down slow, 1, 2, 3, is extremely important. You want to do these 3 to 4 times a week, 2 to 3 sets of around 8 reps. But again, that tempo is really important. Now the second progression is you're going to bring one heel closer to your buttocks to emphasize that glute. And again, driving up with your hips and your glutes. Press your hips up towards the ceiling. Again, feeling that gentle tension in your posterior buttocks and going slow. Again, that tempo should be 2 or 3 seconds up and 2 or 3 seconds down. You would alternate and emphasize the other one and do again the same rep count we told you before. Now the final progression is just a single leg bridge. So you're going to bring one leg in, extend one knee, and drive up towards the ceiling, slow and controlled, and down. Now we find this to be sometimes too much of a jump, so what you may find is you'll want to come up with both legs, straighten one knee, and then slowly go down as a kind of intermediate. So now we'll go over the squatting progression. For those that aren't comfortable with the squat, we highly recommend you start with a chair or a box. For this squat, you want to make sure you keep your weight over your midfoot, and we're trying to emphasize the glutes, so sitting kind of down and back is a good cue. Again, tempo is important, so it should be 2 or 3 seconds down and 2 or 3 seconds up. Again, you should feel tension in your glutes, not your knees. And again, you want to do this 3 to 4 times a week, 2 to 3 sets of around 8 reps. To increase the difficulty, we're going to do alternate or staggered stance. So bring one heel closer to the chair, squat down slowly, and stand up. One thing to note is it's important to stand up with your hips going straight up. You don't want to lean forward and then use your back. So if you're starting to feel it in your back, again, sit down and back with your hips and stand straight up. If you are, you may need to reduce the difficulty. Now again, going down and going back up with the left side, closer to the chair. The third progression is just a single leg squat. Again, slow and controlled and up. Now this is quite challenging, so you may need to take a while to get there, and that's completely fine. Last progression will be a single leg step up. Now we're going to demonstrate with the chair, but we recommend that at home you do something with a less height initially. So again, you're going to put one foot up and step up with your glute, not your quad. Again, slow tempo, 2 to 3 seconds. So again, we're emphasizing that posterior buttocks, not your back or your quad. Now, one important with this exercise is we want to keep our pelvis level, and we don't want it to dip towards the opposite side, which we'll demonstrate in this rep. So again, as you stand up, you want to make sure your pelvis stays neutral and does not dip. The last series of exercises are going to be some exercises in the coronal or frontal plane, which is the side-to-side plane. So the first one is just a side tap. So you're going to stand on one leg and just tap slowly and come back. Again, all the weight should be on your stance leg, and you want to make sure that you try to keep that pelvis neutral and you're loading that hip, not your knee. Again, tap, come back. Nice and slow and controlled tap and come back. And again, the rep count will be similar, 3 to 4 times a week, 2 to 3 sets of around 8 reps. The next progression for this is going to be the banded slider. So you'll need a chair, something to lean on, bands that you place around your leg just above your knees, and then a glider, something that you can buy. If you don't have this, you may try to use like a cloth on a hardwood floor or tile, and you're going to hold onto the chair, kind of sink back into your hips and press your leg out as far as you can slowly, and then bring it back. Again, you want to kind of keep it from coming too far in or adduction, but again, press out as far as you can and back. If you need to make it more challenging, you can increase the resistance of the band. But again, sinking into that hip and feeling that posterior buttock is important. Again, 3 to 4 times a week, 2 to 3 sets of 8 reps. So one important thing to note with this kind of rehab is intensity is really important, as increasing the intensity over time. So a good way to monitor that is with RPE, or rate of perceived exertion. So if you're not familiar with that, think of 0 as no intensity at all and 10 as intense as possible. So through the weeks of doing this, if you're doing a 4 or 5 intensity, you should increase to 6 or 7 over time, working all the way up to 8 or 9 to get the full benefit of the therapy. Anyone dealing with this should look into Alison Grimaldi, which is a world-renowned researcher and PT out of Australia. In the links below, we add a podcast that we highly recommend you listen to, as well as a site that she has a lot of great information for. Thank you so much for watching our video. Really hope you found it helpful with this troublesome condition. Also, please let us know in the comment sections what you liked about the video and anything that we can improve upon, as we're trying to help as many people as possible.